find so invaluable and different about this grant program is that United really understood the value of letting you guys do what you do without your hands being tied to having to do it a specific way, which is so rare and invaluable.
Your priorities are our priorities, and there's no more important provider for our community and state division than the community health centers, because you serve our Medicaid members, almost, in many cases, almost exclusively, depending on which state you're in. And so, we have, over the years, really sought to find ways to help support our community health centers, recognizing all the work that you do, and that you can't really understand the depth and breadth of the role that community health centers play in each community until you actually go visit one and see what you guys do day in, day out.
Thanks to United and thanks to ACH for empowering us to do a project that we've been looking at doing for years. So we've had a really robust care coordination team, QI team, just population health team in general. And we've talked about workforce issues and having staff and systems to support providers and value-based care, and how we can reduce costs and improve quality. And our care coordination system, population health delivery department, has been fantastic, but it's been mainly reactive. So we see a significant problem, the patient experiences a significant problem, and we then react to it. So we've wanted to use technology and this whole emerging field of AI and machine learning to take the data sources that we've collected now for years in EHR, pharmacy, dental, and claims, and start to make predictions about when is somebody going to go to the hospital or likely to get really sick. So we're really excited to make this shift from reactive to proactive population health management. Some key successes is we already had claims data from the payer. We have good access to our EHR data. So the data access portion of it is going well. The challenge is kind of bridging that gap and matching everything properly. So that's one lesson learned. And then what we're really laying the groundwork for is then how do we deploy the actual additional resources to go out and reach out to the patient and take action on these interventions.
First of all, my name is Marie Millay. I am the president and CEO of Morris Heights Health Center. We're located in New York City, mainly in the Bronx and in Brooklyn. And I'd like to start by saying thank you so much for this grant award, and thank you for the value that is placed on our community. The award that we received was around our aged population. So life does not offer many guarantees. However, one that we can say we can absolutely count on is that if we are lucky, we will age. And if we are really lucky, then we'll age well. Hence the name of this program, Age Well. Our Age Well program puts the odds in your favor by creating an extensive and deliberate care team model for our older population. This program is a strong care coordination model, inclusive of primary care, skilled nursing, remote patient monitoring, home health service, food pantries, physical therapy, occupational therapy, nutrition, social work, talk therapy, peer-to-peer interaction, relocation services, and socialization activities, and dental services, including free dentures for those 50 and plus. When possible, these services are delivered at the patient's home. The care coordination and support has resulted in an increase in well visits, a decrease in uncontrolled hypertension and diabetes.
I'm Sheila Oach, and I'm the Chief Engagement and Equity Officer at Lowell Community Health Center in Lowell, Massachusetts. Lowell, Massachusetts is a community of about 120,000 people. We are home to the second largest Cambodian population in the US. So what this funding is allowing us to do is we are creating a health justice learning institute. But when we talk about health justice and what we want to do as an organization, we talk about equity. Equity is in my title as a role, but really is taking it, at least for our organization, our vision of a just and healthy community, taking it to that next step. What does it mean to go from equity to justice, which means the removal of the barriers that I feel for the past day and a half we've been talking about in this room for many of our communities. So our Health Justice Learning Institute, and I'll say Institute for short, looks to really equip healthcare professionals across multiple professions with the tools, the knowledge, the skills needed to have the courage and conviction to practice their medicine, to practice their profession in a way that really provides access to our patients coming from multiple cultures and areas. And our communities are rich with talent and skill, but oftentimes many of the communities that we serve do not have the opportunities to go through those career trajectories that some of us have had the privilege to be in. So our institute also is looking at how do we create those pipelines for somebody to become a medical interpreter like myself, a community health worker like myself, but then go to perhaps becoming a nurse, maybe a doctor, an MP.
I'm Teresa Dotson. I'm the Director of Financial Affairs at Mountain Comprehensive Health Corporation. And we go by MCHC, it's just a whole lot simpler. But we are located in rural Kentucky. And as you can imagine, we have a workforce shortage just like everybody else. And I'm going to say it may be a little bit more compounded in our area. You basically have to travel to go away, to go to school, and a lot of times our residents don't come back. And so we have a really hard time not only with recruitment but retention. We started a program called RAISE, and that means Reach, Achieve, Inspire, Support, and Employ. And so, kind of self-explanatory there. We want to raise employees up, and we also want to give them a raise for that achievement. We originally started with the University of Louisville as our main partner through an apprenticeship program, because the great thing about apprenticeship programs, in case, because I didn't know this before we started this, is that you can do the on-the-job training. So they could work and learn our way while, getting paid, not having to lose that. So we originally enrolled 12 entry-level employees into the MA program, and Stephanie actually is the teacher of that as well, and their mentor. But entry-level, housekeeping, reception, medical records, and that was last January, so 12. And let me say we have 526 employees right now, so that'll come into play. So they worked for us, they've done their clinicals, Stephanie trained them. We just graduated our first class of 12. Very thankful for that. But in the meantime, we got to thinking about what else can we do? So that's a need. We knew we wanted to start our own pharmacies. Everybody's talking about the 340B issues, and so we knew that we needed to do our own pharmacy. So we didn't have pharmacy techs. So we thought, well, we'll add that apprenticeship program. And again, we need nurses. And I'm going to say thanks to UnitedHealthcare and ACH in this grant opportunity, we currently have 133 of our employees enrolled, and that's 26%. If you take away the 92 skilled providers and the other staff that are bachelors and above, that goes up to over 30% of our employees are enrolled in some pathway. And what that has meant to us is, and let me just say, there's no cost to the employee for anything. We cover it all.
Thank you, ACH, and thank you, United, for the opportunity to work on our project. And it really started with the conversation with the superintendents of the school districts. You know, we're in Eastern Washington, Basin Health Association, very conservative part of our state. And so the school superintendents wanted to address youth suicide, but the school boards were not interested in formal school-based health centers. And so our project was really developing the technology, a AI chatbot for behavioral health that can be deployed into the school districts. We started with training and development of staff and the school's teachers for being able to address how do we bring behavioral health access into the school districts without actually having somebody in there, and actually make it a friendly program. It's QR code based. We put it on backpack tags, really, and also Stanley cups embedded with a QR code for all the teachers. And in just about 4 months, we got over 1,000 appointments for the students back through via telehealth. And now it's gotten to the point where via the grant, we've assigned 4 BH consultants to actually work in the schools, and now it's viewed upon in a positive manner. Essentially, they scan a QR code, and it starts a chatbot conversation about how they're feeling. If it's an emergency, they're connected with a county designated mental health professional because we want to address it immediately. If it's not an emergency, they have access to a website that has all the information they need for how to cope with anxiety or depression or anything that they might be feeling. And it also connects them with a behavioral health consultant at whatever school they have interest in being seen at, or they can schedule an appointment with one of our counselors at the clinic, and it connects them to self-scheduling, and we've gotten most of our connections done in that format.